Okay.
Hey guys, it's Dr. Loeffler. I'm here with Hunter today, and we're going to do a little video about sort of what it means to be a fear-free vet. I think it's a broad term that not everybody fully grasps at this point. It's getting to be a newer thing in vet med, and sometimes I think clients come in with a little bit different expectation of what might actually happen. What it means to be a fear-free vet is that we're actually taking into consideration your pet's emotional needs as well as their medical needs that they have for that day. It means that things like nail trims, ear cleaning, stuff that we wouldn't consider a top priority may not be all accomplished in that first visit when you come in. Some dogs, and even some cats, if they've had previous bad experiences at the vet, sometimes all we do is we talk and we give your pet treats and have a good experience and you leave, and I never even put my hands on your pet for the first visit. So know there's sort of that full spectrum. Again, sometimes dogs have had a bad experience and I can use, you can see we've got all kinds of stuff. We've got peanut butter and cheese. We do use actually sun butter. So anyone with nut allergies, don't worry about that. We've got all kinds of treats, baby food. This is a very small portion of what we have. We have a lot of stuff that we can use to try and make your pet feel comfortable. Sometimes it works great on the first visit. Sometimes it doesn't, and sometimes we have to come up with another plan. That plan may include pre-medications. So usually it's you going home with a medication to give the night before and then about 2 hours before your appointment. And that's both to help with some sedative effects and mainly the anxiety, to take that away for your pet so that we can more easily accomplish the things that make them scared when they are here. Sometimes we have you do just what we call a trial. So you do it at home with nothing happening and report back to me and let me know how it went. So I can tweak the doses to try and avoid you coming in and then me saying, oh, let's tweak the dose, try again next week, and avoid that. So pre-visit medications are definitely a big thing. Other things that we do, it really varies by pet. I saw a dog today that when he comes with the other dog in the household, he's a lot better and more comfortable here than when he comes on his own. And that sister just gives him a boost of confidence. And we've been working with her being in the room just as the tag along. So sometimes that makes a difference. Owners, you guys can play a big role in this. Sometimes you guys are really, really good at keeping your pet calm. You know what they like, whether it's how they're being talked to, how they're being handled, things they dislike. Sometimes on the opposite end, they feed into your anxiety. So you're already worried and nervous, you know that something's gone bad before, and it feeds into your pet here. So sometimes we do ask you to step out of the room to see if it makes a difference. For some dogs, it makes a big difference because they're like, oh, now mom's not here. No one else in the room is anxious with me. I think I can get through this, versus mom's a ball of anxiety. Sorry, moms, we're picking on you guys right now. Ball of anxiety sitting in the corner, and I think I should feed into that. So it's never against you when we ask you to step out of the room. Sometimes it truly does help your pets. Those are some of the main things we do. We do a lot of what we call happy visits here, where we literally come in, they get treats, they get to have a good experience here and spend time here in a good environment, and not necessarily have a lot of things happening to them. We also do some desensitization here, so getting them used to being handled, touched in certain ways so that we can accomplish different procedures. Sometimes I give you guys homework to do at home. It does often include muzzle training. So muzzles sometimes get a bad rep, but muzzle training a dog can be huge. What it means is that I can safely accomplish things I need to with a lot less restraint for your pet, because I know they're unable to bite me. Does not mean I'm going to push your pet to the point that they're trying to bite me through the muzzle, but it does mean I don't need a technician, sort of that regular hold you would see doing that. Sometimes now all they have to do is hold their collar, because we know everyone's going to be safe, and the pet feels way less anxious with that versus a lot more restraint. So there's all kinds of things. We do sedated exams sometimes. If your pet has had a bad experience at a vet in the past, please reach out to us. We can come up with a plan. We can review records before you ever even step into the building to try and make it the best success we can. But know that success doesn't always happen on the first try, and sometimes we need to tweak our plans, but we're always willing to work with you to try and make it work. Thanks, guys.